When I decided to go into surgery, the early hours that surgeons have to keep or adhere to didn't deter me. I was used to that and I kind of enjoyed it. Surgeons are up early to the operating room early. So when I'm on call on weekends, the thing that we started years ago was to feed the people that have been working for the last 24 hours and feed the people that were coming in to work. So I just think this is a nice way to say, I appreciate you. I appreciate what you're doing for our patients. Dell Children's is the only level 1 pediatric trauma center in Central Texas. And that is a big asset to this community. And I think people that understand trauma understand that, understand what a wonderful thing that is for the city and actually for the whole of Central Texas.
I saw her yesterday as a walk-in.
All right, so what's the issues today that I have to worry about? The commitment to being a level 1 takes a lot of resources. And we have pediatric boarded emergency room physicians, pediatric trained nurses. Everybody's pediatric focused. We are prepared to take care of a child who has been in any sort of a traumatic incident from day of life 1 to the age of 15. Motorbike, like in the street, where were you?
Track.
In the
track.
Did you have a helmet on?
He was playing football and he said, "Mom, I think they have more injuries."
They have a lot of injuries. From the most minor injuries to the most severe injuries, we're prepared. Our trauma center is a high volume trauma center, and in the injuries that we see most often, the pediatric population in Central Texas are motor vehicle collisions, motor pedestrian injuries, falls, and child abuse.
Dr. Garcia is an awesome surgeon, an awesome trauma surgeon. She cares about her patients. She's always thorough and gonna do the right thing for all of her patients. She puts up this front like she's hard, but she's actually super, super caring and very compassionate, and I think it shows to the patients and their parents and families, and I think everybody really trusts her.
Here's a picture of my family, but that's a picture of my son when he was born. This grounds me. I like sitting here, maybe after doing a tough case and just saying, wow, you know, that could have been Greg. Anyway, I'm a mom. It changes how you look at the patient and also how you look at the parents. I know, I'm sorry. So the call was an 18-month-old that fell off the mom's lap with what we call an acute abdomen. Acute abdomen means a rigid, tight, something is wrong with the belly. As a pediatric trauma surgeon, that immediately makes me worry about what? The mechanism of falling off your mom's lap, a foot, does not fit a big injury, right? So it makes me think of child abuse because that is the reality that I live. The CAT scans showed a retroperitoneal tumor on the left side that had bled. So from the fall, most likely the tumor bled into the injury, the tumor bleeds, and the tumor expands. So now, the story changed a little bit, right? We treated it as an unstable trauma, and we now have a child who has a retroperitoneal tumor, and the CAT scan helped us figure that out. Y aquí está el estómago. Esta niña aquí tiene un tumor, y el tumor sangró, por eso se le hizo. I just told the mom that her child has a tumor. She's already scared. So now I'm just telling you out of the blue, your child who yesterday was this healthy, loving 18-month-old has a big tumor that is probably a neuroblastoma and could be a stage 4. And it has a lot of hard months ahead. Day in the life of a pediatric trauma surgeon can be extremely rewarding, stressful, and heart-wrenching. At the end of the day, when I leave here, yes, I'm tired sometimes, but I feel that this is a wonderful place, and I'm ready to come back tomorrow.